Hey guys, welcome back to another video. So today's video we are talking about natural family planning method. So we talked about artificial family planning, we talked about permanent family planning, and now we have started talking about natural family planning method. So natural family planning method, I want to say that it was practiced with our forefathers. Our forefathers and our grandmothers are the people who practiced natural family planning method, and some of those natural family planning method are now being practiced by us. Now, I want to say that most of these natural family planning method, they usually don't have side effects. Yeah, they usually don't have side effects, and one of some of them that were practiced with our forefathers were withdrawal method. They also practiced LAM method, lactation amenorrhea method, and also they also practice abstinence. Now, and another one was also use of herbs. There were herbs that those people could take maybe before sex or after sex, and that one could prevent them from getting pregnant. Now, the first three that I've mentioned are still being practiced right now in the modern world. The withdrawal method, the abstinence method, and lactation amenorrhea, LAM. Those three are still being practiced with us or by us. Now, what I want to say today, this natural family planning, we have several of them that came after those that I've mentioned, and I'm going to just highlight them so that we know, and then I will measure on calendar method, because that one is most ladies will really want to know how to use calendar method, how to count calendar method, or you can call it cycle beats. Now, I don't know if this video will be too long, so that I can divide all these videos in sections, but let me see so that I don't put a long video where you will get tired watching it and you might not get whatever I want to say. So guys, I've decided that I'm going to divide this natural family planning, these traditional methods of family planning, into 3 videos. So let's start with, okay, I will speak about the first 4 that I said how they are supposed to be used, and then I will talk about the 4 main that we are still using today, and then I will specifically discuss calendar method so that you know how to use it. Yeah. So what I want to say that lactation amenorrhea method is used. It is the use of breastfeeding as a contraceptive method. It's based on the psychological effects of suckling to suppress ovulation. So when the baby is suckling or the baby is breastfeeding, the hormone that supports breastfeeding suppresses the ovulation. To use breastfeeding effectively as a contraceptive method of family planning, you need to have these 3 points. Number 1, the baby must be below 6 months and below. The baby must be exclusively breastfeeding. What do I mean by exclusive breastfeeding? Exclusive breastfeeding means that the baby is totally depending on breast milk for a period of 6 months without even water, without anything, unless the baby is sick. When you can take the baby to the hospital and then she or he is given the right drug, but apart from that the baby will depend on breast milk. And another point is that the baby, you as a parent or you as the mother of the baby, your monthly period has not returned, is when this lactation amenorrhea will be effective for you. Now let's look at some of the advantages of this lactation amenorrhea. Number one, it is highly effective. It doesn't have side effects of any kind. It doesn't interfere with intercourse. Anytime you want to do an intercourse, you can just do it that within that period of 6 months, so long as you're comfortable and you have already your postpartum period. Another thing, no medical supervision is needed. You will be taught how to use it and you can just use it. No cost involvement is needed, and those are some of the advantages about it. For the child, passive immunization is boosted. Transfer of protective antibodies to the baby is highly effective, and also the baby will get best nutrition from the milk, and then also reduce the contamination of the baby being exposed to water, to food, to any other formula feeds. To the mother, it also accelerates ovulation and decrease postpartum bleeding. When you're using lactation amenorrhea, you might rarely get postpartum bleeding, and also increase bonding with the child. Those are some of the benefits. And sometimes it is difficult to use it because your monthly period can come before a period of 6 months, but if it does not come, you can just use it. And also when you are working, you might thought that the baby is exclusively breastfeeding, and it will also be very hard for a person who is working, because this person won't practice exclusive breastfeeding, because the baby has to depend on other things as the baby also breastfeed as you also go to work. So it's difficult for mother who is working to get to practice this amenorrhea method, this lactation amenorrhea method. Now in this video, let me talk about abstinence. It's abstinence as a method of family planning. Abstinence is a very effective, acceptable method of family planning. It doesn't have any problem. It doesn't have any side effect. It's just there. It protects you from getting HIV, unwanted pregnancy, and safe abortion. So that things which abstaining from sex can help you. You can avoid them. Let's talk about coitus interruptus or withdrawal as a method of family planning. Coitus interruptus is the withdrawal method of the penis just before the man ejaculates or before ejaculation occurs. Now, this method needs cooperation and discipline. If it cannot cooperate during the intercourse, and then this method is not for you. And the worst thing about it is it usually have a failure rate, because sometimes a man can ejaculate, the semen can pass with sperms, and you might get that you get before even ejaculation, you're already pregnant. So I won't advise you to use this method because of the failure rate. But if you think that you are a king of withdrawal method, you can go ahead and use it, because it is also one of the family planning method that if you know how to use it, it can be effective. So let me rate there. Let me stop this from there. If you have not subscribed, kindly do so. Like my video, share, comment, and let's meet in the next video. Bye till next time.